see here, Reading was at 681 discharges per 100,000 people, so or per 100,000 discharges. And Massachusetts is at 772 as a sort of connection. So when we think about the fact that Reading was doing so well in physical health outcomes when we compare to Massachusetts and Middlesex County, but that's not the case here for mental health. So there's definitely something happening within mental health that could be an area of focus. Other sort of survey components that relate to mental health that I'll just pull out quickly. So over 50% of responses experience negative emotions in the past 2 weeks. And those negative emotions were sadness, worry, or despair. So again, that mental health theme of half of the people completing the survey said that they had these emotions. Marilyn, I see your hand up.
Oh, hi, no problem. I can't remember if we collected income data. Did we?
That's a good question. I don't think we asked income specifically, but
I'm just thinking mental health treatment typically has high copays and limited coverage for most plans. So if there's a way to get at it, I think that the family's ability to afford it might reflect the incidence of treatment for things, as opposed to necessarily it being a difference of prevalence of the physical mental condition. So it's just something to keep in mind.
yeah, that is an interesting point, although the comments about what those needs are and lack of access to mental health were coming up in terms of affordability as well. So
Right, but that could be the other side. It could be the people that didn't have the discharges because they couldn't afford it. We just don't know. What caught my eye was Winchester. I spent some part of my life there, and my experience was it in general was more affluent, and you see higher numbers there. And so I'm thinking maybe the copays and all aren't so prohibitive in a more affluent community, and that affects the data. But just throwing it in, but great data, really interesting.
Absolutely. And all of this is just the tip of the iceberg.
Yeah.
To your point, like around access, that could very well be, folks not having adequate access for ongoing care. And so some of the comments later on in the survey, you'll see that feedback as well. Paula?
I was just going to say, as a piece of the access part is availability. I mean, I know that a lot of people are having difficulty finding providers, and that's never mind the expense finding somebody.
Yes, absolutely. Okay. I'm going to move on to this next one as well. So when you start to think about like what could be contributing to somebody's poor mental health, there's lots of stressors that could fill in that gap. But thinking about stressors related to cost of living or monthly living expenses, what we saw in the survey tool itself is that 10% are worrying consistently about their monthly living expenses, and then another 20% are sometimes worried. So that could be in and of itself contributing to some of the mental health concerns that are out there. All right, move over. For question 9, tab 9, we asked folks about their whether a health problem or a disability limited their ability to participate in activities that they would normally do. And 1 in 4 responses said that sometimes, usually, or always they experience a limitation due to either a health problem or their disability. So that's something to take a look at, and is actually consistent with some of the feedback later in the survey that we received around folks interested in designing places, spaces, and programs that were inclusive for all ages and all abilities, and really thinking about how, if you're grappling with a health problem or disability, it would be tremendously challenging to conduct daily activities if places, spaces, and programs were not as inclusive and accommodating as they can be. So there is a connection there as well. Paula, do you have another question?
No, I'm sorry. I forgot to lower my.
That's okay. Coming over to this tab, another piece that was raised was affordable housing. That's not unique to Reading. It's a state and national problem, as you know. But affordable housing was brought up across the focus groups, the interviews, and then the survey tool itself as a primary priority need. And so just looking at the numbers of folks who are worried about not being able to afford their rent or mortgage, you can see that about 15% of those completing this survey were sometimes, usually, or always sort of that bucket of worry about their mortgage or rent. So I'm going to jump over to some of the services, because this is come up earlier in the conversation. So we asked folks to identify if they had trouble gaining access to services or programs or items that they needed. And those who said they had trouble, mental health had more than 20% of the vote, almost 1 in 4 said that they had trouble accessing services, specifically mental health counseling and therapy for adults and also children. So it's a problem that is impacting both sides of the population age groups. Also to point out, healthcare access in general, although you'll see in some of the data, folks are really good about getting the preventive access to health screenings and accessing a doctor annually. There's still a group of folks that are having challenges accessing care. And again, coming back to points that were made earlier, it could be about transportation. It could be about wait lists. It could be about affordability. And we saw that some of the verbal or some of the written responses as a part of the survey tool. And here's just a little bit more along those lines. So folks were saying they didn't know where to go to get the service that they needed. The service was too expensive. The service didn't take their type of health insurance that they had. And then lastly, services are not offered at available or convenient times. So what I'm going to do for some of these data pieces, and I made a note here just to mention it for you all so you know what's going to happen from here, is I'm going to dig in a little bit more deeply and look at some of the cross-tab opportunities. So I'm going to try to look at what was the service and then what was the response or the reason that was a barrier and match those up more formally. So when we see that somebody said mental health services were not available, we could say more specifically why. Is it not offered at the right time? And that will help you sort of guide your intervention strategies from there. Okay, so moving over into when we asked folks to essentially select 3 important health needs in the town of Reading, and we gave them some options to pick from. The first leading need was mental health support and services. The second item selected was healthy aging. And then the third was healthy behaviors. And there were lots of responses within the focus groups we did in particular around the selection of healthy behaviors over chronic disease, or even over mental health in some cases, as being the foundation for everything. So just keep that in mind in terms of folks are very interested in finding the opportunity to get as upstream as possible and create healthy behavior to prevent the chronic disease or condition. So if we can keep people engaged, will we decrease, rates of depression or other sort of anxiety or worry within the population, because there's ways for folks to engage as one thought that was brought up through some of the focus group pieces we were talking about. And certainly the intersectionality of all of these things, because they don't live in their own little vacuum or bubble. So when we think about the strategies, some of the strategies you might select will be cross-cutting across these different buckets if they're selected as priority needs. We also asked folks to tell us the top 3 most important community health improvement needs in the town of Reading. And top of the list was places, spaces, and programs that are designed for people of all ages and abilities, as I previously mentioned. Also, people were interested in community locations to socially connect and engage and come together as community. And in the focus groups in particular, there was a talk around community center and a hope that there could be a location that would bring people together more formally. And then also affordable housing, as I mentioned, and lastly, community design. And this sort of universal design concept, when we brought it up in the survey and in the focus groups, we talked about it more exclusively to healthy aging. And I just want to make a note for this group that folks were interested in seeing this applied for everyone and saying that, yes, you might do this type of universal approach that will be helpful to older adults, but it has universal application across the community. And so folks are really supportive of that. Marilyn?
Just a sort of an update, the Recalc Committee, Reading, I can never remember what it stands for. The group that's been researching what we need in terms of a new community center or elder center, or senior center, whatever they're going to call it, age 60 plus center. That they're one of their findings that has evolved while this work has been going on should be looked at in their first report, because the conclusion was that what the evidence showed was we really need a senior center primarily, and to the extent that it can also serve community purposes, great. But the first priority, number 1, is senior services, a senior center and senior needs. So when this was done, it was more, they were looking, could it be a community center with designated senior stuff? And now it's more senior stuff with also community stuff. So just to be in line with where the town thinking is going on it. And there's an RFQ that went out and they're evaluating the results right now to hire a designer to help us do a feasibility study and think this all through. But to keep up with where their thinking is going as we go forward in this, it will be important to align the conversation in that terminology, I think. Otherwise, we risk setting them back. And it's not that we had new subsequent findings, they're just 2 parallel paths. And our wording was more consistent with their earlier thinking than the current, I would say.
Absolutely. Is it possible to get a copy of that report? Is it publicly available?
It's on the website, I believe.
Okay, that would be helpful. A day?
So it looks like only 13% thinks that we need to reduce community stigma around seeking and asking for help.
Yes.
Okay. All right, I thought that would be a higher number, but it's all right.
So in terms of process, we certainly heard it in the interviews and the focus groups a little bit more loudly, if you will, than we did in the survey tool. And I think part of it is when folks are forced to rank, they're selecting one over another. So we did hear some comments within the focus group that all of these things are important, all of these things are relevant, but if you're going to ask me to pick one, I'm going to pick this. So I'm saying it that way because I don't want it to fall off the list. It certainly was shared as something that's important. We just asked folks to pick the top 3 out of these items.
Sounds good.
Okay. And then the last sort of survey piece that I wanted to share, which would be great if, once you have access to the survey tool itself, you can go in and take a closer look. And this is another place where I can do some of those cross tabulations that I mentioned to see who is saying what as a part of this process. But I tried to categorize the responses at higher levels. So you can see in the red here, you have infrastructure, community design. So people were talking about walkability and bikeability and green space as things that they would like to see as improvements and have some ideas about how to do it. So this list here starts to give you insight on what residents think should be done to improve that sort of topic area. And so I'll just scroll down. There's physical activity and recreation, and there's suggestions that are both around infrastructure, like things like build more, pickleball or basketball or tennis opportunities or gym equipment outside, to, around inclusive programming and access to adaptive recreation programming for folks of all abilities, and free programming and ways to bring people socially together. Folks mentioned healthy food access. One quick note, a lot of the comments related to food were more about gaining access to the quality of the food and less about being food insecure. Doesn't mean it doesn't exist, but just through this process, that's what we heard. Housing, as I mentioned before, affordability of housing was top of mind. Social connectedness and engagement, same thing. Infrastructure, so you'll see comments are in here. Marilyn, to your point about both a senior center or a community center or other center to bring folks together. Types of programming that they might want to see that would engage folks, and even suggestions around, know your neighbor type programs that would really just build out neighborhood connectedness, never mind larger community.
And Jamie, I will get you that link to the recalc report. I'll email it to you.
Oh, great. Thank you so much.
Sure.
Equity and inclusion. So, as I mentioned, adaptive, inclusive programming, thinking about engaging everyone in the community and what that means for creating programs. I will make a note here. We heard strongly from the focus group participants that folks are not interested in programming that's exclusive to a population. So as an example, doing something specific to a Portuguese speaking population. Folks are most interested in trying to build out community-based programming and resources that keep language in mind and incorporate language within a broader context. Same with adaptive and inclusive programming for folks that might have disabilities. Folks are less interested in having a program for somebody who has, say, a physical or cognitive disability, and more interested in finding ways to include that population in the program that could accommodate everyone. So I think that's important when we think about the strategies. There were a fair amount of comments about local business and economic growth, and in particular the downtown area, and wanting to see that thrive and grow. There were some comments about healthcare access, again, mental health services in particular. Some comments about education and early childhood education, lack of affordable childcare. And then lastly, there's a bucket here on related more to like governance and policy related issues for the town of Reading. So again, I'm going to go back and do some cross tabulations to try to pull out who's saying what to help us shape those strategies as appropriately as possible. If nobody has any additional questions or concerns or comments, I'm going to go ahead and stop my screen. A day. So you
Can we go to tab 26, please? I just want to see something on there. Okay, can you go to the graph? Can you scroll up, please?
The graph, please.
Okay. So it looks like this is going to change based on the 10 additional paper surveys that we got. Seems accurate, right?
Correct. Yes. Yeah. Once we get the 10 in there, it will change.
Okay. All right. Sounds good.
And just sort of, I pulled some demographic information in here that you'll see when I share it, to do some comparisons to like census data and other things that are available. So for populations 65 and older, just to see if we were able to get some additional information from folks. Reading's population is about 18-19% of the population is 65 and older. For responses, our cut was from 60 and older, and we had about 22% of the responses coming from those who are 60 years of age and older, just as like a way to look at whether it's a representative sample. The
We,
same,
oh, I'm sorry.
go ahead.
Oh, raising my hand to be official. Thank you. We could get the data for Reading of 60 and older so that it's consistent. And 60 is the sort of working definition of people who are in elder services. So if we could look at it, we keep hearing it's 27% these days. It's 60 and over. So town census certainly can give us the exact number for Reading, and it's around 27%, which would mean our survey is a little low compared to, well, we don't know because you're looking 65 and over, but anyway, that's readily accessible data.
Yeah, okay. Yeah, we can look at that for sure. Thank you. Also, one note about demographics that I just wanted to point out that is not aligned with your population is we're typically seeing a 50-50 split within Reading. So you can see from a demographic standpoint, 49.5% male, 50.5% female. And this is just using census data that's available. Our survey responses were much higher for women than men, so for females than males, as a part of the survey process. So we were at about 68% were actually female, or should be flipped, and 22% were for male. So that's an important point to just pull out here in terms of data limitations. And we'll make those notes as a part of our process in the findings report. All right, any other questions? All right, I'm going to go ahead and stop sharing my screen there. And then just really quickly, I'm just going to show you this so that you know what it looks like when you get it. This is a document that I'm still working on because I'm pulling sources from lots of different resources and looking at formats that make the most sense. But I wanted to show this to you. This is the data snapshot that I mentioned. So we have a population level data snapshot, which is pulling in what you would typically see from census and some of the other community-based reports. And then, I don't want to make anybody dizzy, but I'm going to scroll down. And then we're also pulling in the health data. So we have a health data snapshot as well. And pulling out from lots of different sources. When I can find Reading information, I'm pulling it in. And that's where the comparison might change. So as I mentioned, there's some sections that are comparing it to Mystic Valley and Massachusetts. And then there's some sections that are doing comparisons relative to Middlesex County and the United States. It just depends on the availability of the data that we have access to. But this is another tool for you to go in and really look at all of the data in one spot and shot that we have about Reading and the surrounding region. So because this one is a little bit of a work in progress, as I'm encountering new sources, I'm going to put it in a Google Doc format for you all so that you can see it as I'm updating and refining. And I would welcome you all putting in notes to say if you'd like to see something. I don't know if I can find it or access it, but if you have a specific interest or wonder, please add it in there and we can do our best to try to find a data point that matches. Okay. All right, so from here, I'm going to be pulling all of these pieces together, as I mentioned, and sharing it back out with the team. And between now and our next meeting, you'll have the time to go through it all and really digest it, if you will, at a different level. I'm going to pull out some of the crosstabs and interesting items that were mentioned here so that you have that information as well. And I'm going to put out a survey to you all to try to capture some of your initial thoughts as you're going through the data to prepare us for our meeting in December so that we can come in with some idea about around what you might be interested in focusing in for priority related needs. In terms of next meeting date, I know we had set a frequency of the first Tuesday or second Tuesday of every month. It appears that that's not the best option for this planning team. So I'm going to go back to the drawing board for December and try to find a date that can really meet the majority of folks to make sure that folks are able to participate, because I think that's an important meeting. We also need to select a date for Board of Health, or whether you all have a Board of Health date already selected, Dr. Lopez, for December. That would be something to get on the calendar as well.
We typically meet the second Thursday of the month. Actually, we weren't necessarily planning July and December. We often don't meet, but you know, if I think in terms of perhaps if we needed to have a special meeting for this topic alone, we could certainly do that. You know, I think you'd want to make sure that the planning, I don't know if you would need time between the December planning meeting and the board meeting to sort of consolidate the ideas so that at the board meeting, there's more structure to it or not. So I don't know, that's probably your decision.
Yeah, if you were running earlier in the month, perhaps we look at the January date for that meeting instead of December for the Board of Health.
Yeah, that would give the planning committee also more time to more options in terms of your meeting in December to.
Sure. Yeah. Okay, that sounds good. So we can look at January for Board of Health, and then it gives a little bit more room for December for this team.
Yes.
Okay, great. All right. Any other questions or comments before we adjourn? Marilyn?
Just in terms of dispersing information as we know it, I don't want to jump the gun on this is an open meeting and it's being recorded, so anyone who wants to watch it will have access to everything you've just shared. But I know how frustrating it can be to be doing the first blush and everyone instantly jumps to the bottom line conclusions before you've had a chance to really dig deeper. Do you have any thoughts on that? I know there will be people on the Council on Aging, for example, and probably that recalc committee as well, if not select board, that'll be really interested in seeing results. So how can I be supportive in sharing? I guess that's my question.
Sure. Yes, yeah, that's a great question. I'm actually going to defer to a day to see what your preference is in terms of sharing this level of information beyond the committee.
I mean, eventually we're going to get like a document, right? And
yes, yep.
document will be open to everybody. It's going to be on our website. It's going to be everywhere. So, I mean, I don't see any reason why we should withhold the document. So I'm not sure I'm understanding the question, but
yeah, sure.
RCTV is recording, which means, at least for all the other committees I've been on, that means it's going to be posted on their website for anyone who wants to watch this meeting soon. You know, it usually takes them a day or so to get it up there, but that, if nothing else, will be there. Plus, this is an open meeting. I believe, yeah, I think I saw it on the town meeting. It's posted as an open meeting, so there will be people who I know have been asking me already, when will we see something? This is really exciting. When will we see something? So I'm suspecting there will be people who will already start looking at everything we've shared, which is, I don't have an objection to personally. I think it's great. That's the interest. I just want to be supportive of Pear Associates in this clearly being first cut draft exploratory analysis in my mind, and not letting people think that these are the findings, and without our digging deeper. So I just don't know how to best share it, or if we have any control. That's all. I'm just raising it and trying to be sensitive to it.
Okay, I think I understand it now. But I think we can put something that says draft on it so people don't get misled. I think that would be the way to go forward. You just label it as a draft copy and maybe put a disclaimer on it and go from there.
Great.
Maybe even
Great.
preliminary draft.
Something like that.
Right. And in terms of the document itself, this will, once we have the priorities identified, this will become more of your community health needs assessment. That is sort of the final piece that I need to actually formulate that document. There is a step in between that document and this process here. So as I mentioned, we're compiling all of these resources, data, engagement findings into something for you to review. So those are the pieces that I think it's just important for the town and this group to understand that it's all just preliminary until you really identify what those priority needs are. So any of the information that was shared today is certainly just that information. No decisions have been made to date, and that'll be the ongoing process that we have with this group and the Board of Health, and then that broader partnership group that I mentioned around strategies and including folks that have expertise.
So would you be able to resend the preliminary data and make it so that people cannot edit the data and just put it as a draft? So if Marilyn wants to share it, she can.
Yeah, what I could do is pull things into like, I guess maybe just more of a findings report with some of the key highlights from the survey, the focus group findings and interview findings, and then that data snapshot that I showed as like, here's the information we're looking at to identify what those needs are. Does that make sense?
Oh, also, if you could even just, watermarks in the background, and let's say, preliminary draft diagonally across the page, things like that. Just avoid confusion. That's all.
Sure. Absolutely. Okay.
Plus, you might want to note in it the data is still being entered. So yet another reason why it's preliminary draft. It's haven't got those 10 extra
We're
responses
still
in there yet.
entering more data. Yes. Okay. All right. Well, thank you all. And I will be in touch to find a date in December for us to get together.
Great.
Thank you so much, Amy, for all your,
Thank you.
You're doing a great job. Thanks.
thank you.
Thank you. I appreciate it. Bye-bye.
Bye.
Bye-bye.